My name is Dr. T.K. Gossett, and this is a video on new information regarding the causes and treatment of peripheral neuropathy. Now, I assume if you're watching this video that either you or someone close to you is suffering from this condition. Now, it's important for you to understand this is a very serious condition. The reason I say this is because the medical authorities have categorized this as a degenerative condition. In other words, it only gets worse with time. Now, with traditional health care, the best that can be expected is for the symptoms to be managed. Meanwhile, the condition itself, the underlying condition itself, continues to get worse with time. The primary focus of my practice has evolved into diagnosis and treatment of chronic and severe conditions that are not responding to traditional forms of care. Most of my new patients have been to their primary care doctor, a couple of specialists, and maybe even a chiropractic physician or two. As I noted on the introductory video, there are several reasons that I am unique or different from other doctors that you've been to. First of all, it's the postgraduate study that I've taken part in. Second of all, it's the practice experience that I have. And third of all, it's the high rate of success that I am able to achieve with my patients. So let's get started. So the first question is, what is peripheral neuropathy? Peripheral neuropathy is an interference in the nerves which carry information to and from the brain and spinal cord. This results in pain, loss of sensation, and inability to control muscles. Now, peripheral neuropathy is one of the most common chronic diseases in the U.S. Over 20 million patients a year suffer from it. So what we're talking about is almost 10% of the public, the American public, suffers from peripheral neuropathy. Peripheral means distant, neuro means nerve, and pathy means disease. So this is a disease of a distant nerve, resulting in nerve damage, disrupting the body's ability to communicate with its muscles, skin, joints, or internal organs. It's as if the body's electrical wiring system is breaking down with shorts, causing numbness, pain, weakness, and poor coordination. Now, there are 7 common signs of peripheral neuropathy, and this can occur in the hands or in the feet. They are numbness, burning, cramping, sharp electric pain, pain with use, difficulty sleeping from the discomfort of touching the bedding, prickling, stinging, tingling sensation or feelings. Now, the symptoms depend on which type of nerve is affected. The 3 main types of nerves are those that carry sensations, those are sensory nerves, those that control muscles, those are motor nerves, and those that stimulate organs and glands are internal organs and glands, and that's autonomic. So there are 3 different types of nerves that are affected in this kind of condition: sensory, motor, and autonomic. And that affects our entire body function. So peripheral neuropathy is not just involving your hands and feet, it involves your whole body. Damage to sensory fibers result in changes in sensation, burning, nerve pain, tingling, or numbness, or an inability to determine joint position, which causes incoordination. For many neuropathies, sensation changes often begin in the feet or hands and progress towards the center of the body with involvement of other areas as the condition worsens. Diabetes is a common cause for sensory neuropathy. Now, as we look at the next slide, let's look at how we utilize our energy. Which one of these systems do you think utilizes 30% of our energy? There's the endocrine system, which builds our hormones and keeps our hormones level and keeps our organs functioning normally. There's the digestive system, which breaks down our food and then results in production of energy for us. There's the nervous system, which communicates and controls all of our body's function. There's the immune system that protects our internal body from external antigens or external forces. And then there's the cardiovascular system, which keeps our blood and our organs and our tissues oxygenated. Which of these do you think takes 30% of our energy? It's the nervous system.